Great. Welcome back to Healthcare. So we are switching gears to H721, which is an act relating to expanding access to Medicaid and Dr. Dinosaur. And so we have heard from all of the agencies and stakeholders, organizations that this bill would impact. And we need to hear from Vermonters and what the impact may or may not be to them. So we've invited a couple folks with us today, and we're going to start with Erin Keller. Welcome. If you can introduce yourself and then your testimony, and we might have questions at the end. That's okay.
Sure, that sounds good. Thank you so much. My name is Erin Keller. I'm a member of the Vermont Worker Center, and I'm also a licensed clinical mental health counselor in the state of Vermont. I first want to thank you, Representative Houghton, and the rest of the Committee for Healthcare for taking up this urgent issue of the Medicaid cutoffs and for taking the time to listen to us all today. I'm seeing the ramifications firsthand in both my personal and professional life, and want to implore you to both expedite and expand the already great start of Bill H721 for reasons that I will expand upon below. Truthfully, I don't want to be here right now. I would prefer to be providing the care to my clients who I had to reschedule in order to meet with you all this morning. But right now, many of my clients' well-being and my own are actively threatened by our current healthcare structure. So here I am. Before I get to how harmful the Medicaid cutoffs have been, I want to share how and why being on Medicaid was so important for me on my journey to becoming a mental health care provider. During the summer of 2020, I reached the height of burnout while completing my graduate degree and working full-time as a case manager at the Howard Center Methadone Clinic in order to make ends meet. The reason I felt able to transition out of my full-time job to take care of myself and focus on my studies was because I was able to enroll in Medicaid. I wasn't aware at the time, but being able to stay on Medicaid through the beginning of my career both allowed me to pursue a position in a group practice that I love and saved me a significant amount of financial debt and stress. In January 2022, I was admitted to the hospital and diagnosed with type 1 diabetes, a chronic autoimmune disorder, making me insulin dependent for the rest of my life. Being insured with Medicaid while beginning my journey with this expensive disease gifted me the privilege of learning how to care for my body's new and demanding needs. Sorry.
Take your time.
Such that my health and well-being were able to thrive. And I was able to keep my A1C between 5.4 and 5.7, a better A1C than you might find in a non-diabetic person. A year and a half later, I lost my Medicaid coverage, and my health and financial stability were threatened, along with thousands of my fellow Vermonters. In the months leading up to July 1st, I was falling apart and on the verge of panic regularly. I would find myself weeping to my roommates, my close friends, and family. Feelings of fear, hopelessness, and despair were prominent. I was spending hours on the Vermont Health Connect page trying to find a plan that would work with both my budget and healthcare needs. Every plan would end up leaving me in the negative. I've had to borrow money from my parents just to make ends meet since I started paying out of pocket for my healthcare. All of the insurance plans leave me in a state of mystery, unsure of how much to even budget for until I actually fill a script that could very easily crumble my very fragile financial stability. Because of the nature of my illness and my history with autoimmune disorders, like thyroid cancer and juvenile rheumatoid arthritis, I've been paying for the best insurance plan available. From July 2023 to December 2023, between the cost of my monthly premium and the copays for insulin and diabetes management supplies, I paid a total of $3,810. This does not include the copays for office visits and my other medications and prescriptions. When it all adds up, my annual cost of basic health maintenance would end up being somewhere between $8,000 and $10,000, 1/4 of my annual income from last year. Over the last 2 years, my employment, diet, stress management, exercise, and sleep routines have all remained the same and remained robust. However, under the stress of anticipating and actually losing my Medicaid coverage, since the spring of 2023, my body is requiring higher doses of insulin in order for my blood sugar to stay in range. I saw my endocrinologist 2 weeks ago. My A1C is currently 7.6, the highest it has been post-diagnosis. This puts me on a path of being at higher risk of other health issues such as blindness, nerve damage, and kidney failure, to name a few. This illness requires 24/7 care, multiple daily injections, constant monitoring and consideration of how every move I make will affect my blood sugar. And yet the most stressful part of managing this illness is navigating the convoluted healthcare system that prevents me from accessing medication and tools that allow me to take care of myself. There is something deeply disturbing about this truth. As of January 2024, this month, I was able to join my partner's health insurance plan as a non-married domestic partner, which is a rarity. On this plan, I'm saving some money, but the feelings of fear, defeat, dehumanization remain. Because I knew I would be on a new insurance starting in the new year, I waited to fill my insulin script because I couldn't afford $300 copay on my previous insurance. Right now, today, if I were only relying on my insurance to fill my scripts, I would be without insulin. A few days without insulin would kill me. And so what gets communicated through the lack of ease in accessing my healthcare is that my life doesn't matter. For the last several weeks, I've been using insulin that I had to procure on my own that was only made possible because I'm resourceful. I have access to resources that other type 1 diabetics do not, many of whom would have ended up in the hospital or dead in my current situation. I've spent an entire week and more than 5 hours on the phone to fill my scripts for medication required for survival, with almost no success. This is unacceptable and is tied to my concern about the cost-sharing aspect of H721. The chronic stress of not knowing whether you can afford basic health care or if it will suddenly be taken away or become more challenging to navigate if you start making slightly more money keeps the nervous system activated in a state of fight or flight for long, steady periods of time. The result is sustained high levels of cortisol that wreak havoc on the body, both mentally and physically. Cost sharing will have this effect on Vermonters and has had this effect on me. It will complicate a system that needs to be simple in order to be effective and for people to use it safely and appropriately. We are living through a mental health crisis, and it's irresponsible to ignore that the Medicaid cutoffs are directly expediting and intensifying this crisis. And adding cost sharing into the Medicaid system should also amplify this crisis. I'm seeing it play out in real time. I can think of several clients of mine who have either lost Medicaid and discontinued therapy services, have lost Medicaid and picking a new plan has exacerbated the symptoms of their mental health struggles that we've been addressing, or have been actively trying to update their healthcare information and currently do not know if their coverage will be renewed. For one of these clients of mine, I'm not charging her sessions for the month of January because she was told that she won't be covered by her new insurance until February, and she can't afford to pay out of pocket. And I can't afford to keep working with her and not getting paid. It is a lose-lose situation because we have a strong therapeutic rapport, which is the most important factor in determining a client's success in therapy. Insurance is all we can talk about right now. I have another client who is working with a case manager to do the Medicaid redetermination. They are both not sure what's going on and if she will still have Medicaid coverage. I spent another entire session with this client on this subject because of how distressing it has been for her not to know. There are underlying issues that we now can't address because of the way insurance struggles are interfering with these clients' lives. I only foresee this intensifying and getting worse because it has since the Medicaid cutoffs began. As a provider, I'm scared for the field of mental health care and deeply concerned for the communities and people we serve. Another aspect of the H721 bill that I wanted to speak to and that I'm very excited to hear about are the increased reimbursement rates for providers. However, this also brings up several prominent concerns. Just this past year, Vermont Medicaid performed an audit with the Special Investigations Unit, and the result was pulling back hundreds of thousands of dollars from colleagues of mine. The SIU is supposed to support with corrective action, but instead these audits have been financially punitive to the point that there are several clinicians in our community that have either had to file for bankruptcy or close their practices entirely. Additionally, many members of the counseling community are beginning not to accept Medicaid or any other insurance at all because of the fear of these clawbacks. We are actively and presently losing a mental health care workforce that is accessible to the working class. Under a Vermont statute, all insurance companies are only allowed to audit care performed within the same year. This is true for all except Medicaid, who has free rein and is able to pull back money years later. I have heard directly from other clinicians that this is one of the reasons they will no longer take Medicaid as an insurance, and many others that are only allowing out-of-pocket pay clients in order to ensure their livelihood is not jeopardized. I have personally lost my own therapist of 6 years to this very issue. If you will be increasing reimbursement rates, then we absolutely need to see more oversight and limits to audit power for Medicaid and the Department of Vermont Health Access. This also means more psychoeducation for staff of the SIU and staff that are trained as mental health professionals. We also need to see higher reimbursement rates for family therapy as well as service coordination. Right now, there is no way for providers to get paid for coordinating with a client's other providers, which is actually best practice. We're expected to do this in our already busy schedules for free. There are many people that are qualified to offer family therapy and will not because the reimbursement rates are so low. There's a large need for family therapists in our communities at this time, and it would be in all of our best interest to support these providers through higher reimbursement rates. As you can see, a 6-year rollout plan for Bill H721 isn't sufficient, nor is the addition of cost sharing or reimbursement rate increases without oversight. These aspects of the bill are not addressed. We will see an increase in mental health crises and no mental health workforce to respond. I appreciate you all for taking the time to listen to the very real and detrimental impacts of the inadequate healthcare system in our state. And I look forward to watching and seeing you carry this forward as you have the power to prioritize the health and well-being of our communities. Thanks so much.
Thank you, Erin, very much. Thank you, Erin. Does anyone have any questions?
Would you be willing to share your testimony?
Sure.
That'd be great. Thank you. Very poignant, sorry.
I have a question, and you do not have to answer this.
Sure.
I'm curious, so you were forced off Medicaid.
Mhm.
Was that through the redetermination process?
Yes.
And this is the part where you don't have to answer. So Medicaid goes up to 137% of the poverty level. This
Mhm.
bill, as written, would go up to 312%. I'm curious where you fell in that range, your income when you came off the redeterminations.
Mhm. I'm not sure exactly where, but it was not much more over. I last year my income was just a little over $38,000.
Okay,
Okay.
great. Thank you. Thank you for sharing that. Art?
Yes, you talked about the audit.
Yeah.
Did you think the audit was unfair, inaccurate? What is your complaint, I guess?
So that I know exactly what she's talking about, and we could go down a real rabbit hole here. So
Okay.
we are going to bring it into committee. I want you to ask the question and answer it, but I don't want to go into a long overdrawn because we will come back to it. It is an
It
issue.
just struck me
Yeah.
because I have just as a background, I have a constituent in kind of the same boat.
Yes, probably. So I didn't mean to interrupt you, but just know that.
Yeah.
Yeah. Mhm. I guess what I would say to that, to try to not go down this rabbit hole, is that a lot of it is like I said, it was supposed to be corrective action, not financially punitive. So if there are issues with charting, it's a lot of clerical stuff.
Right.
So if there are issues with charting, then there needs to be corrective action and follow-up, not pulling back people's financial livelihood. Because people aren't going to keep working.
Did they offer any sort of a plan for payback?
I can't speak to that for the
Okay, all right.
individual peoples, but I think it's something that I know is being worked on. But it's the fear as a provider. I go to bed, I think about this at night.
Well, I'm sure.
It's a little similar to what we've been talking about in 766.
Yeah.
In that they're looking at what's in the notes and what's coded and all of that, and they are saying they are finding problems with them, and so they are calling back payment and may or may not be doing education or other things. So we will be bringing it forward to have a hearing to understand more of what. Yeah, no.
And I think it's that, my understanding, I'm not sure if this is something I heard from another provider, is that the folks kind of performing the audits I think are trained as nurses. And so that's where I think maybe having people that have been trained or worked in the mental health field would be a little bit more accurate and helpful.
So Alyssa and then Daisy, and then we'll go to the next person.
From somebody who the very first time in my life this past year had to actually go and purchase my own insurance through the exchange and not through an employer, I'm right there with you. I thought I knew this stuff. I didn't know it until I went on there. But I wanted to, wondering if you would talk about your experience on, trying to buy insurance through the exchange. And you don't have to share this with us if you don't want to, but, whether you were eligible for subsidies and like how much you were paying.
Yeah.
And I know with type 1 diabetes that, that's got to constantly be in your mind with out-of-pocket costs.
Absolutely. Yeah.
So
Yeah, I think
maybe what plan level you were on.
Yeah. Thanks. I was on Blue Cross Blue Shield Platinum.
Okay.
I did get a subsidy. Even with the subsidy, I forget how much it was for, but I was paying a monthly premium of $435. And then my a 3-month supply of my continuous glucose monitor was $300. And then a 3-month supply for the insulin that I needed was also $300. And I also take thyroid medication. And then there's I need syringes and a backup glucose monitor. And so it adds up quite a bit. And then that's also not including kind of copays and whatnot.
Daisy?
Thank you so much for your transparency and sharing this story. It's really powerful and incredible. I just really appreciate it so much.
Thank you.
I don't remember if you said where you're practicing, and I wanted to kind of learn more about the care coordination piece because I agree it is such a key component for wellness and recovery for a lot of folks. As someone that has a therapist and just really appreciates the work that you do.
Sure.
I'd like to work on how we can improve that care coordination, whether it's turning on a code or there's a lot of different elements to that. So can you tell us a little bit more about where your practice falls so that we can better understand how to improve that?
Sure. So I'm in a group practice for Vermont Center for Resiliency. And again, the service coordination, these are if we're going to make, so if I'm coding for a session with a client, it's just the time that we're meeting together. Outside of that, emails, kind of phone calls, following up with other providers. There's no bill. There's no code to bill for that. And so is that kind of what you're asking?
Well, I just want to know what type of practice are you at, or are you a private provider?
It's technically a private practice, but it's in a group. So it's kind of in between, if that makes sense.
And are they, do they have any federal designation? Are they an FQHC?
I don't think so. Yeah.
Great. Thank you, Erin, very much.
Yeah, thank you so
Appreciate your time away from your patients, and tell them we said thank you.
I
Giving us your time.
Thank you.
Okay, we have Heather. Is it Bauman? Great, come on in. Do the same thing, have you introduce yourself and then provide your testimony.
Thanks. Hi, my name is Heather Bauman. Thank you for having me. I'm here representing several different constituencies. have a constituency of 2 back home, and I am also president of the Support Staff United at UVMMC, the newest union at the hospital, and 2,000 members strong. So thank you again for having me. Yeah, so I have these constituencies that I care deeply for and refuse to fail. My kiddos grew up in Vermont, CVU graduates, working hard, and the joy of raising them and the stress and the burden was shared with the state of Vermont through Dr. Dinosaur. So thank you for that. They are as healthy as they are because of the care they received. And hard conversations, devastating medical diagnoses through their childhood, and the state of Vermont stood with us while we walk through that and continue to walk through that. And so the expansion of Dr. Dinosaur to cover kids through 26, as the ACA thinks should be done, is vital to me and this tiny constituency that I represent. And it's also important to my colleagues at the hospital. I'm a phlebotomist there. I started working as a phlebotomist. I actually, when my youngest was getting towards the end of her high school career, to get back into the work that I had done before, which was at Planned Parenthood. And just so grateful to be in Vermont, and the energy that's put into, and the reproductive freedoms, and worked hard last year on the, or I guess a year and a half ago now, on the amendment, and proud to do that, and proud to stand with Planned Parenthood and those union workers as well. So I was here last month when the bill was read out, and I was just so proud to hear it. There were so many things that just pinged and meant so much. And thank you for the depth and the reach of that proposal. It's amazing. I moved to the Green Mountain State 20 years ago, inspired by a governor who declared that I'm a doctor who believes that every Vermonter deserves affordable health care. When Governor Dean spoke about the dread that knots in parents' stomachs when they try to figure out how they would provide care for their children, they can go without themselves, but they can't stand to think of their kids not having coverage. That resonated with me, and it made me really proud to be a Vermonter. And I really appreciate the rededication to that expansion of care for all Vermonters. So the 2,000 folks at UVMMC that I get to work next to and represent and in their union, we just 18 months ago started whispering conversations about getting together and forming a union. And it was pretty scary for a lot of the folks in this group, low-income wage earners, a lot of new Americans, and a lot of people unfamiliar with their potential political power. We won our election a year ago. We began bargaining in May with the hospital. And after a 12-hour session at the end of September, we're able to TA an agreement that we ratified in October. The process was extremely hard. It was really informative, fascinating, and a lot of good came out of it. We found the courage to share our needs, share our stories. We found the courage to imagine what a more supportive experience as essential healthcare workers, what that would look like for us. And we were able to walk away with wage increase. The starting wage at the hospital was $15 an hour, and it's now $20 an hour. It's spectacular. We were able to get some guarantees around job security and workers' safety and time off, which mean a lot. But obviously, we weren't able to come to agreement with the hospital on everything. And there was one area where they just steadfastly refused to talk to us, and that was around access to healthcare, equitable access to healthcare. So the current system in place at the hospital is a regressive system, right? Everybody pays 20% of the cost of the insurance. And obviously, if you are now, if you were then earning $15 an hour, that was out of reach. If you're now earning $20 an hour, it's still out of reach, and you're paying the same amount as the person earning $200,000 a year. And, you know, if you think about it, our folks, if they are going to buy into the hospital's healthcare plan, it's costing them upwards of 20% of their wages to be able to access care that way. And the beautiful thing about the wage increase meant so much, you know, filling fridges and all those things. And it also kicked a lot of folks off of Medicaid. So they can not afford the hospital plan and they are no longer eligible. While we were bargaining, folks came forward and shared their stories of the inaccessibility to healthcare before on the wages. I had a colleague, Amanda, who's worked at the hospital for 23 years, and before the contract, with all of the seniority, she was earning $24 an hour. She had a 16-year-old son, sweetheart, who came and spoke as well. Dreams of playing professional basketball until he injured his knee. Amanda had never been able to afford the hospital's health insurance in her 24 years, and her son was uninsured. After his accident, she worked with the Medicaid eligibility office and got him on Dr. Dinosaur, and he was able to have the surgery to repair his ACL, and things were looking really good, except for while the surgeons were operating, they discovered a mass in his knee. And so this malignant tumor was removed, and now he's getting treatment. And that happened right around the same time as her wages went up. So I also work with a lovely person, Josephine, full-time at the hospital, also has a second job, decades of experience, stage 4 cancer, $139,000 in medical debt to the hospital for bills they refused to pay through their own insurance. When we were getting ready to come here, I asked my colleagues for stories. A young woman named Madison reached out. She's a full-time student working at the hospital as a CPSA. She pays $450 a month for health insurance. She's a young person, and we talked about like what her dreams and aspirations were. She thought she wanted to be an RN, and then she thought, oh, that's a lot of work. And maybe she wants to be a doctor. She's trying to figure out how to attain these amazing goals. I mean, she's an amazing colleague, citizen. Her parents are both deceased. She's terrified of going into debt. If we expanded the care to 26, she'd be covered. Right now, she is not. She's investing all of her time and energy into her future, into our future, and has found that she can't, do it the way she wants to. She has enlisted and will be joining the Air Force because that's the only way that she can figure out how to get healthcare and an education. A colleague, Takorian, reached out to me, a single mom who works a day shift and a night shift to make sure that she and her child get what they need. We are, as a union, promoting GoFundMes for colleagues who can't afford care, and that just doesn't seem equitable at all. So in his State of the State, Governor Scott was wondering where the workers are. We're at work. I mean, we're here, we're getting it done. We're Vermonters. We got the job security protection so that we could keep our jobs and so that we weren't competing with travelers for hours. We're here, we're shopping at local businesses, we're paying taxes, our kids are going to local schools. These are the young people that you want to keep in Vermont, and we're trying to we would love to work with you to keep them healthy. It's, again, it might be hard to see us because we're working extra shifts to pay for what we need. It might be hard to see us because we're all wrapped up in PPE as we go into COVID rooms, This idea of being resourceful, I really appreciate that Erin said that, like, we're doing the best we can, and we just need some help. We're not doing the work. We don't not have the courage to stay up all night and ask ourselves these hard questions to try and figure out how can we care for our small constituencies and our larger constituencies? How can we care for our families and our communities? So I just implore you, please don't ignore us. Please, as we summon the courage to tackle these tough problems, not just to talk about them, but to face them head on with action. Please join us. I mean, failure is not an option in these situations. And so Yeah.
Thank you.
Thank you, Heather.
Brian?
Hi. So, you spoke a little bit about this, but I wanted to ask a more direct question. What would you say is the impact on the healthcare workforce to be giving your labor to provide a service to the community, but then to be denied access to the very good that you are producing?
Devastating and demoralizing, you know, I mean, you think about when Dr. Ethan speaks to the Green Mountain Care Board and breaks about the excellent care that's provided when people walk in the door at UVMMC. And we wonder, well, what about us? We come in through the employees entrance and we can't get it. You know, we'd love to have the services we provide. We put ourselves on the line providing care. And it would be nice that in those moments when we break down and we need some care, that it was available and accessible to us without having fear that that same employer is going to come after us to collect medical debt. When we were bargaining, the hospital, we brought up healthcare reform in July and the hospital didn't reply. And so we were like, oh, so maybe got lost in the shuffle of proposals. So we presented it again in August and they didn't reply. And so we couldn't figure out what's going on. So we're coming up to the end of bargaining and a group of us went to Dr. Leffler's office and implored him to come to the final bargaining session. And he did come and he promised that he would protect the most vulnerable of us. He said that he wouldn't let anything happen to the most vulnerable. And it was, you know, again, we want all these amazing things. It was pretty devastating to let go of any reform to the healthcare access. So he promised to protect the most vulnerable and they promised to create a committee to look at accessibility that would meet within the first 3 months. When we came earlier or last month to hear the readout of the bill, the press was here and they went to the hospital for comment. And that same day, the hospital stood up the committee 4 months after our contract had been ratified. We had that first meeting last week. It was a 60-minute presentation from the hospital that shared some ideas like combating the rising cost of healthcare by adding a dependent subsidy, requiring those of us with children to pay more to access the hospital's care. They also suggested an increased cost share, increasing the deductibles, copays, and co-insurance. And their other idea was a spousal surcharge. But they did also say that no change could be implemented before January 1st, 2026. 2026. So as someone who loves the most vulnerable of the Vermonters, I can't wait until January 1st, 2026.
Other questions? So, go ahead.
Does you work for UVM,
UVMMC.
MC, right?
Yeah.
Do they offer, well, I'll give you an example. I worked with a phone company for years. We got free phone service.
Yeah. Yeah.
Benefit for working at that facility. You get, free business for free or something. Do you get anything like that? Or they offer that?
So Mari might know better than I am. It used to be that like X-ray services were free or something like that way back in the day. No, it costs 20% of the cost of the premium, which represents approximately 20% of the income of my colleagues to access the care. I think if you get stuck, if I'm a phlebotomist, so if we get stuck, they'll run the lab stat to make sure that we don't have HIV or HP,
So like if you hurt yourself in your duties, in your job duties.
We're exposed to a devastating
But
life.
there's no
Yeah.
general benefit that the hospital provides for employees. Free coffee on Mondays.
They pay for that as law, that's law, that they have to pay for that if you get a need coffee.
They also, it was funny in their presentation, they were also saying like, oh, we've expanded healthcare. It's amazing. We offer, we cover hearing aids and we did that out of the goodness of our heart in 2023. And I was like, no, you didn't. So thank you for that.
We had nothing to do with that.
Yeah, you did.
So I just want to clarify. So, the union negotiated a $5 an hour raise. About, I'm,
20% plus. We have over 100 job
so we're just gonna generalize if that's.
generalize it.
Generalizing, which is approximately $866 a week. Yet that amount that people would say is a bit more to a livable wage, probably in Chittenden County, not a livable wage. Yet because of that slight increase, people now fell over the 137% of the poverty level, and therefore they lost Medicaid and now have to pay 20% of a health plan, which is potentially could be more than $866. It's probably is more than $866 a month.
Yeah, for a single kiddo, it's, she's paying $450 for the premium that doesn't include the copays and the deductibles.
Yeah. Okay.
Yeah,
So
so-
I just wanted to be clear that you're
Absolutely.
you're working to achieve a better position within your organization. And when you do that,
Yes.
the policies that we have in place are continuing to knock some people down. Okay. Brian, Mari.
Yeah, and I think it just illustrates, I think it was Art the other day, you talked about the cliffs, that this is an example of workers advocating to be treated better, to have their labor valued more, and then them falling off a cliff because of it, because the others, it's set up for people to fail. And then the other thing I just want to highlight is, like, Art, you brought up the phone company thing. I think healthcare is probably it's sad that we're like one of the most essential like services, but like healthcare workers are not given the basic services that we provide back to us. We don't get the free phone. Like we're actually in this position where it's increasingly, we're being pushed into underinsurance essentially, which is what you're describing. So.
Daisy, no, Mari, and then.
UVMMC is a private company. They're not for profit, but they're private, so they fall under National Labor Relations law. My understanding that healthcare is a mandatory subject of bargaining.
Yes.
But it sounds like just because it's a mandatory subject of bargaining doesn't necessarily mean that that technically both the union and the hospital have to bargain in good faith. That doesn't sound like it's happening, and it doesn't sound like there's a reasonable offer. So there's ways to get around having to improve access to healthcare. It sounds like this is the first offer that you got from the hospital.
This is our first contract. The offer, there was no offer. There was a side letter. The offer was to maintain the system. And again, like this vulnerability, I mean, again, what they said to us is it's really complicated, which felt a little patronizing. Yeah, it's complicated and it's expensive, but it's also an investment, and again, to tell the most vulnerable to wait. And I guess I just implore you to have both a sense of urgency and a commitment to action around this, that, talking about it until 2026 does the most vulnerable in our communities no good. Dr. Lepler's an ED doc. He knows you can't put that off for 2 years.
Thank you very much, Heather, for all your work, for coming today. Abel Luna? Did I say that right?
He's on Zoom.
Oh, there you are.
Yes, hi everyone.
Hi, welcome.
Hi, thanks everyone for making this space. My name is Abel Luna. I'm an organizer with Migrant Justice, and I'll be reading a letter or a speech that one of our members wrote, and sharing his experience on the healthcare system and the importance of supporting this bill. Okay, so I'm gonna get started. Hi everyone, my name is Eric Alfaro. I am a young adult and part of the migrant community here in Vermont, working on dairy farms. And not too long ago, I just turned 19. I'm not able to be here today due to work. but I wanted to talk about my experience with the healthcare system and the importance of passing and supporting this bill. I want to start off by saying that it doesn't matter who you are, where you're from, what age you have, or your immigration status. None of these things should matter when we're talking about a person's life and their life being at risk. I believe that everyone should have access to medical attention when needed, and I have to choose between food being at your table, all your healthcare, going to the doctor. I was one of the youth in my community who benefited from the IHIP program for the youth under the age of 19. While I was on the program, I was working on a farm, and I just want to say that being on a farm, there's a lot of things that you're exposed to, risks, dangers, chemicals, and I can name a lot of other things. And having or being covered under the IHIP program, having the ability to go to the doctor was very important to me as a young adult. I was able to get the shots that I needed. I was able to get physical examinations that I needed, receive the medical attention that I needed. So while under the IHIP program, I was also able to go to the dentist for the first time in a long time. The first time that I went to the dentist, I didn't have to pay because I was still under the program. The second appointment, when I visited the doctor for the second appointment, I turned 19 just a few days before going to the doctor, so I had to pay out of pocket. And since then, I have not been to the doctor. And so, although I was under the IHIP program for a very short time, it made a huge difference in my life. And I want you guys to know that it really supports us. For us, for youth, it's important to know that the state has your back. I just turned 19, as I mentioned. I don't have any form of healthcare. I continue to work long hours. Now that I'm older, I work even more. I have more responsibilities. My health continue to be at risk. Aging out doesn't mean that you stop working or that you don't no longer exist. And just like me, there's a lot of other youth here in Vermont that is going through the same situation that they have just aged out. So being able to access the doctor, makes us feel safer at work. We don't have to get in debt, or we don't have to spend time thinking about, how we're gonna pay these bills, or how our family, where the next meal for our family is gonna come from. So Vermont needs to raise the age bar to 26 so that other younger adults can qualify for programs like IHIP and similar Medicaid programs. It is unfair that at my young age, I have to decide between going to the doctor or having to put food on my table. Is this what Vermont really wants? Is this what Vermont really wants for the future generations? I don't believe so. So just wanted to share that I'm starting to retake school. I want to finish my high school. I want to pursue my dreams. I have a lot of them. And I don't want to have to worry about how I'm gonna pay for my health when I get sick. So don't just think about me. I want you to think about other youth in Vermont that are in my same shoes. Think about your families. Think about your loved ones as you make these decisions. And I think together we're gonna make the right one. So that's all I have to share.
Thank you. For reading that testimony, and please thank him for providing that testimony. He's the first one we've heard about that joined IHIP and was able to access that. That started in this committee, and let him know we're super happy he was able to do it, and we hope we can move it. I will speak for myself. I hope I can move it along to get up to 26 on that program. So thank you. We won't ask any questions since it's not your testimony, but did you have anything else you wanted to offer?
I think just a very few short words. I think outside of Eric's testimony, just I think it's important that we are ensuring that all of Vermonters have access to healthcare. I think the stories that you have heard today, you will continue to hear them. If we don't take any action, we'll continue to hear the stories of, people going to the doctor, people not having access to healthcare, people having to choose between putting food in the table or, or making a choice of if they're sick. Those stories are going to continue to happen. Nothing is going to change if today we don't take any action. And I think it's important for Vermont to be inclusive, and not leave everyone or anyone behind. The communities that are most impacted are, the poor communities, the working class, that is making sure that Vermont continues to thrive, Vermont continue to, to make progress. And that is because, the working class, and I think it's unfair to ask us to, put a lot of work, but at the same time, when we need to access healthcare, the state doesn't have our back. And I think, unless we include everyone, we cannot say that, Vermont is taking steps in the right direction. I think so far we've done a good job. And, like I hit program and other programs that have allowed our community to, to access healthcare. I think we can do much more. And I think that is why we're here today, to encourage you guys to do so, and to know that those programs have really made a change in our community. A lot of, women that are pregnant, women that have no healthcare, through these programs, they don't have to worry about, having to feed their children or going to the doctor. And I think these things are really key. And as Eric mentioned, I think we're gonna make the right decision. So I think that's all we have to share. We appreciate the time.
Thank you. We appreciate your time and all your work with Vermonters. Thank you. All right, Andy, I think you're on Zoom as well. Hi.
Yeah, hi. Can you hear me all right?
We can, yes. If you can just introduce yourself and then start your testimony.
Yeah, sure. So as you know, my name is Andy Lindquist. I am a bookseller full time, and I'm also a cartoonist who's been tabling and canvassing with the Vermont Worker Center since last spring. Um, so I moved to Vermont into the summer of 2020, and I applied for Medicaid as soon as I moved there. I just turned 26. And I'd been taken off of my mom's health insurance. And while I was attending school full time, I was also working at a grocery store, which was felt very hazardous at the time. Obviously, there is basic health workplace protections. There was an official masking policy, but I still really felt at risk. There was a lot of exposure from communal eat areas, non-compliant customers. Um, but even though I had a lot to worry about health-wise, I wasn't concerned about going into debt if I had to be taken to the hospital. Um, I had a really good experience being enrolled in Medicaid with my access to healthcare. It was the most consistent healthcare I've received in my adult life. Even when I had been enrolled in my parents' healthcare, I consistently went for my annual physicals for the first time. I was able to get my repetitive stress injuries from working both at the grocery store and from drawing examined. I was able to go to the endocrinologist without having to surmount any financial barriers. And I think the thing that I always bring up when I talk about my experience with Vermont Medicaid was my ability to access gender affirming care when I was enrolled. Um, there's a misconception among a lot of folks that gender affirming care, especially care that involves surgeries, um, colloquially top surgeries or bottom surgeries, is purely cosmetic. And in fact, many private insurances won't cover gender affirming surgeries on the basis of them being cosmetic rather than medically necessary. However, gender affirming surgery is life-saving. Trans people are always saying this. But what I mean when I say that is having top surgery to remove my breasts was necessary as a trans man. Being able to leave the house without wearing a restrictive binder to flatten my chest has allowed me to live a healthier, more active lifestyle. It's allowed me to enjoy hiking around the beautiful Vermont landscape without having to choose to wheeze on the trail or to have people give me looks. My mental health is a lot more stable. I'm not hounded by the psychological and physical pain of dysphoria. And the changes in my body from both surgery and from my hormone replacement therapy have given me a lot more energy and motivation to become involved in public life and to be more active at my job and in my social life and in my community. If I hadn't gone on Medicaid, I probably wouldn't have been able to access top surgery at all. As I mentioned, it's a procedure that few insurance companies are willing to recognize. And even when they do, there's a whole series of other doctor's appointments and tests and letters of approval to obtain before you can get top surgery or bottom surgery. And this in itself can be a really big financial burden if you don't have Medicaid to cover it or a supportive healthcare. In the US, I was looking it up, and 29% of transgender adults live in poverty. Every time I see my bare chest, I think about how fortunate I am to have been able to access the care I needed. And I also think about how it's care that all of my trans siblings should be able to access, regardless of their income level. But left to privatized healthcare, it's care that countless numbers of people will continue to be denied, or they will have to stay in unsafe relationships or unsafe work environments in order to access, which is, I think, an unreasonable demand of them. But in any case, I was cut from Medicaid this fall. It was for my luck in becoming a salaried worker with a livable wage. But unfortunately, in between being cut and applying for a new plan, I became very ill, and I had to go to the emergency room and to be treated for fever and dehydration. That visit, along with subsequent tests and doctor visits, cost me over $3,000. I am working with the hospital's financial aid department, but I'm still trying to figure out how I'm going to pay for that cost. When I was sick, I considered skipping an ultrasound that was ordered for my liver because I knew it would cost hundreds of dollars to get. I wasn't sure how much, but I knew it was going to be a lot. Similarly, I've also been putting off getting my COVID and flu vaccines because my new plan hasn't been in place yet, which is pretty risky given that I work in a retail environment and I'm exposed to a bunch of people who no longer mask. There are so many people in the state of Vermont who have to make decisions like that, who have to take unnecessary and unhealthy risks because their insurance doesn't cover it. And I think just from a statewide perspective, I think that just doesn't make sense. And from a purely human perspective, I think it's kind of unconscionable. So I'm really glad that we're looking at expanding Medicaid. I do believe that it should be open to everybody, but I think we need to at least expand the program. That's what we need to do in order to ensure everybody's safety and well-being as workers and just as people.
Great. Thank you, Andy, for your testimony. Glad you got the care you needed, even though it's put you in this financial bind. It's important to get the care that you need. Does anyone have any questions, Brian?
I mean, it sounds like Medicaid allowed you to have access to care that you may not have had access to if you paid exorbitant amounts for private insurance. I'm curious, if you had to just summarize, what might be some ways that we could improve Medicaid for your case?
Yeah, thanks. I think, do you mean improve it as what did I notice when I was on it?
Yeah, were there any problems with it that you think we could, or, it sounds like, because it was clear that you may not, or maybe it wasn't clear, and I'm assuming that you would not have gotten the same care on private insurance. It sounds like it depends on the private insurance plan, but Medicaid allowed you to have this vital, essential care you needed for your mental and physical well-being. But what were the remaining barriers that we might consider?
Yeah, thanks for asking. I think the first thing that comes to mind is access to mental health care. It's something that Erin really talked about in her testimony, but I mentioned that in order to get gender affirming surgeries, you often need to get a letter of approval from a mental health worker of some kind to feel like they're doing it, they're mentally sound. And that's a huge barrier. I was really lucky in that I still had a relationship with a therapist in a clinic that I attended before I moved here, who was able to provide me that letter before I came. But if I hadn't had that, my procedure would have been delayed. I was not able to find any providers, mental health providers when I was on Medicaid who would accept me when I looked in the time frame. So I probably wouldn't have gotten that care then. And also, I was lucky in my case because I had family who was able to take care of me afterwards, but getting top surgery is a pretty physically the recovery is quite a long time for it, and you need a lot of help for day-to-day tasks afterwards. So I think post-surgery care could probably be improved, or access to help and transportation would be a real lifesaver for a lot of folks who don't have those support systems in place privately.
Great, thank you.
Thanks.
I don't think there's any other questions. Thank you for your time. We really appreciate you providing testimony.
For sure. Thank you so much for listening.
Yeah.
Thank you so much.
Okay.
Yeah.
Back.
Someone wasn't talking.
Yeah.
It's okay, everyone, go for it.
You want to introduce yourself for the record?
Sure. My name is Kate Cannelstein. I live in Burlington, and I'm the director of the Vermont Worker Center. Thank you so much for the opportunity for all of us to testify today in support of H721 and for your work on this bill, which I believe really sets out the right policy direction for Vermont to tackle our healthcare crisis. As I said, I'm the director of the Vermont Worker Center, which is a statewide organization founded in 1998. And for the past 15 years, we've coordinated the Healthcare as a Human Right campaign to make healthcare a public good. And we were very active in the effort to pass Act 48. We're currently also part of a national organizing drive of people on or unfairly excluded from Medicaid, with the aim of raising the profile of the 16 million people who have lost their Medicaid so far with the rollback of the pandemic era expansion, including almost 30,000 people in Vermont so far. I want to underscore something that really, I think, came through in everyone's testimony, which is just a sense of urgency and moral purpose to this issue. I'm aware that you've been discussing that much of this bill may be committed to a technical analysis this year, and we don't necessarily know a timeline for that, but we do know that about 1,500 Vermonters are getting kicked off Medicaid every month right now, or are delaying care and losing loved ones, or going into debt due to the cost and lack of access to healthcare. So we really, really encourage you all to advance this bill as introduced, and really applaud and appreciate your effort in bringing this forward, and just want to give you encourage you to take it all the way now. If it's okay, I'd like to comment on a few specific aspects of the bill. First, under section 3 on the timeline, we understand there's some administrative things to figure out to implement a program like this. But once that is in place, why not expand coverage up to 312% of the poverty level immediately instead of in steps? And that would allow thousands of people who are struggling right now to get relief as soon as possible without waiting. In section 5 on the reimbursement rates, just wanted to say we really support Planned Parenthood in requesting that reproductive and gender affirming care also be included in any analysis of mandatory rate increases. And as Abella spoke to in section 8, the IHIP program, this is really critical. And also we think we need to see this as a step towards all Vermont residents being included in Medicaid completely with no exclusion. There's really no justification for excluding people based on their documentation status from accessing healthcare. In section 12 on the cost sharing study, Erin spoke to this a lot, but we're very concerned that cost sharing, especially if the purpose is to generate revenue to pay for expanded coverage, would create a 2-tier Medicaid system and replicate the barriers associated with private health insurance plans. We all pay into Medicaid through our taxes already, like that everyone has a stake in this, but cost sharing in healthcare creates barriers and prevents people from accessing care. Finally, we'd like to propose adding language to section 13 or 14 to conduct an updated analysis of public financing for Green Mountain Care as laid out in Act 48, which we believe is the ultimate direction that we need to go in, and that this bill is an excellent step towards. One of the great tragedies of the 2014 financing plan was that the way that the media coverage really buried the important finding that 93% of Vermont families would have seen net increases to their incomes under Green Mountain Care and had comprehensive health care coverage. Can you imagine that? With a decade of growing inequality since then, we really should know what the economics of that would look like today. The Vermont Workers Center supports this bill and the important step it represents. We hope that the 80 co-sponsors of it, along with the 14 sponsors of S240 in the Senate, will be successful in convincing your colleagues of how needed this really is to be passed as introduced this session with its provisions fully funded. And we really appreciate the opportunity to testify here today. At the same time, we know there obviously will be opposition to the provisions in this bill. There are many players in the healthcare industry who will attempt to dilute or derail it by casting doubt on it, and they're with the aims of maintaining their power and role in the healthcare industry. And we know there will be false narratives that we just can't afford it. But we really, truly, and I hope that our stories here today can break through that to see that we cannot afford not to do this. The human and moral cost of any delay is enormous. And so we hope that our testimonies today also demonstrate just the importance of hearing from ordinary Vermonters on this issue. And we really are grateful that you have seen that importance and invited here today. And we hope you will continue to do this. We would ask actually that you would hold a public hearing in order to hear from many more people like the stories you've heard from today, and hope to be partners in building support for this critical legislation.
Thank you, Kate. Any questions for Kate? Brian?
If it's not possible for the legislature to hold a formal public hearing, does the Worker Center think there would be a value to having an informal public hearing on the State House steps or something that's not like sanctioned by the legislature?
That's a possibility.
Okay, only because like, I don't know if we can get our organization to do it, but if not, I'd be willing to work with you separately or through the Universal Healthcare Caucus and other ways to just get the voices of people out there. And just to activate the public and have people be able to have a space to come forward and share their stories. I also think there'd be a value to us building community around that because like that does immunize us from the stress that we're facing collectively. So.
Yeah, absolutely. That's always a possibility, but I do think there's a certain weight that comes from a public hearing that's held by the legislature and where it's on the public record and people can really feel, and I think you could probably feel from the folks you heard from today, how moving it is to be heard by our elected representatives in this kind of setting. Thank you.
I will reiterate, anyone is more than welcome to send in written testimony and we would post it. Absolutely. Just on the status of the bill itself. So we had a committee discussion yesterday and unfortunately, in my perspective, we do have to analyze what this would cost. So we're working on a next draft that would lay out how we would do that analysis and exactly what we need to answer. We'll take the suggestions about Act 48 into consideration and we'll move it as fast as we can. And also, part of the analysis could be rather than doing the step process that's in the bill, is there a faster way to do it once the analysis is done? So we'll look at all that, but it probably will be going to a technical analysis. And then hopefully we'll pass it out, but we'll have to see.
I look forward to seeing it.
Bobby?
Kate, I just wanted to reemphasize for the record too. Can you say that again about 93% of families would be seeing a rate net income increase?
Yeah, in the financing plan, and I actually have a copy of the chart if anybody would like to see it, but in the financing plan
From Act 48.
for Act 48, for Green Mountain Care that was commissioned by the Shumlin administration, it was found that under the financing plan that they were proposing at the time, 93% of Vermonters would see their incomes go up with this new.
I thought they would have, okay.
Yeah, exactly. Yeah.
Can you provide that to our committee assistants?
Yes, I can. I have it in my.
And just to be clear, that is because they would not be paying the healthcare costs.
Exactly.
It would be whatever the funding mechanism would be. So
Yeah.
they're even with healthcare and having to potentially pay a tax, which I think was the proposal at the time,
Yeah.
their income would have increased.
At the time, it was progressive. It was a mix of income and payroll taxes that would have made that.
Okay, so that figure includes the payroll tax that would be required to pay for the healthcare?
Yeah.
Okay.
You can send your testimony into.
Yeah, I can.
Just on that note, from the workers, because you're the ED of the Workers Center. So from that perspective, do you know why what's the recollection of like why the legislature didn't choose to move forward on something that would benefit 93% of people over 7%?
That's the question. Yeah.
Yeah, okay. So you don't really know, right?
We're not gonna have Kate answer that question.
So you don't get it either. Oh, yeah.
Kate, thank you for coordinating everyone and for your attention to this.
Very
Thank you.
powerful.
Have a great day. All right, we are coming back at 1:15 to hear from peer support workers in both mental health and recovery. And then we'll have a discussion, potentially voting out the peer support bill. We'll see where we are as a committee. I might be a couple minutes late, so Topper will be